Successful. Then now
Hi, my name is Dr. Sally Baxter, and I'm thrilled to be talking with you today about cataract surgery. What is a cataract? So, cataract is when the lens of your eye becomes cloudy. This is a really dramatic version that you can see in this photo, where you can actually see the cataract without the microscope. And you can see this hazy, cloudy lens in this patient's left eye compared to the regular darker pupil that we expect to see in the patient's right eye. If we were to look at the eye from the side, we can see that the structures of the eye, so the front of the eye is the cornea, the colored part of the eye is called the iris, and behind that sits the lens. The lens, when it becomes cloudy, is called the cataract. And usually your lens will take light that comes into the eye and bend it or refract it into focus onto the back layer of the eye called the retina. And the retina processes that light and sends it to the brain via the optic nerve. That's how you see. So if anything in that pathway is has a disease or an issue, then your vision will become blurry. And so cataract is one of the very most common causes of blurry vision. Um, and the reason for that is that instead of having a nice clear lens that's letting in lots of light and bringing it into focus on your retina, this cloudy lens, the cataract, will actually reduce the amount of light coming into your eye. It also scatters the light so it's out of focus. And that's why you really can't see as well. And so you may notice that your vision is getting blurrier, that colors may look more muted, that it's hard to tell details and make out the edges of things. And it may be hard to recognize details of faces as well. Um, and in terms of quality of life, this can be a real issue, right? You might be experiencing some of these things like difficulty with reading, with watching TV, with driving. Particularly, we have patients who have a lot of glare and like starbursts or halos off the headlights and have stopped driving at night as a result of their cataracts or stopped driving altogether. One key thing that we think about with surgery is that glasses are not cutting it anymore. So you might have been noticing that your prescription's been changing over time as the cataract's gotten worse. But there comes a point in time where even the best pair of glasses is not going to correct your vision further. And that's really when we're thinking about doing cataract surgery. So this diagram kind of shows you what cataract surgery looks like, obviously in abbreviated form, but we are making an opening into that clear cornea tissue in the front of the eye. And we put our instruments into the eye to make an opening to access your lens. And we use a special machine called a phacoemulsification machine. It delivers high frequency ultrasound to break up the lens into tiny pieces so we can remove that cloudy lens from your eye. We are using the lens capsule as a support structure, and we insert a new intraocular lens implant or an IOL. That lens implant will give you a nice clear medium to look through so you no longer have this blurry lens, clouding your vision. And it has a prescription on it to help correct the vision. So the benefits are for cataract surgery be to improve your vision, also improve the ability of us as eye doctors to look into your eye and examine your eye. And in some cases, it can even help lower eye pressure as well. What are some risks? Every surgery has some risk. Luckily, cataract surgery is a very low risk procedure overall. It's the most commonly done surgery in the world. But it does come with some small amount of risk, and these things include infection, inflammation, some pain or discomfort or soreness, redness, bleeding, prolonged healing, damage to the surrounding structures, need for additional surgeries, and the possibility that your vision may not improve as much as you would like. Excuse me. Let's talk a little bit about choosing lens implant. The standard lens that is covered by insurance corrects a single zone of vision. It's called a monofocal lens, mono meaning one. Most commonly, people want distance vision correction. And that's for things like watching TV, driving, doing sports like golfing. If you don't want to be completely dependent on glasses for those activities, a monofocal lens with a distance correction is a good option for you. You would then, however, need glasses for near and intermediate work because The lens implant is prescribed for a distance correction. So the things up close will be out of focus, similar to what's shown in this picture where the coffee cup letters are blurry and out of focus, but you can see the distance well. There are a very small number of people who do want near vision correction and they with a monofocal lens. And that means that everything at a distance would be blurry all the time and they would need glasses for distance. These usually tend to be people who've been nearsighted their whole life and they really enjoy being nearsighted. They love to read without glasses and they don't mind wearing glasses for their distance vision. Another option is monovision, and that means you have one eye for distance and one eye for near. And that gives you a range of vision without having to do an upgraded lens. So this would still be using lenses that are covered by insurance. But you are only a candidate for this if you've done this arrangement before with contact lenses or with LASIK. Typically, it's not a good idea to do monovision for the first time with cataract surgery if you've never done it before when you were younger. Now, let's say you want the distance vision correction, but you also want some near or intermediate, and you don't want to be beholden to reading glasses all the time. We do have some upgraded lens implants that give you some additional options. So there's the extended depth of field or EDOF lenses. These correct distance and intermediate, and then multifocal lenses, which correct distance, intermediate, and near. There are also astigmatism correcting lenses that can help correct astigmatism. Those are called toric lenses. And the toric lenses can be sort of added on to a monofocal, an EDOF lens, or a multifocal. So for example, you could get a multifocal toric lens. Or if you only wanted the astigmatism correction for distance and still okay with reading glasses for near, you might get a monofocal toric lens. The thing to know is that the toric lenses, and then the EDOF or multifocal lenses are not covered by insurance. So these do incur additional out-of-pocket costs. And so if you're interested in that, you would talk to our surgery scheduling office and they'll go over the rates for each of these options. Just to be clear, no lens implant has a 100% guarantee of making you glasses free. But we do our best to get you as close as possible for distance or for near, depending on your choice for the monofocal lens. And then if you want to do the upgrade and get the multifocal lenses, those really do give you the best possible chance of avoiding glasses at all distances. However, what's the catch? Besides the cost, multifocal lenses can also have some glare and halos for the first 4 to 6 months after surgery. The reason for that is the lens implant actually has rings on it to divide the light across those different zones. And by dividing the light and using those rings, sometimes you can actually get a little bit of glare off those rings and have some halos. So there is an adjustment period. If you remember the first time you might have used progressive glasses, it takes a little bit to adjust to those. And that's similar to multifocal lenses. It's like putting a progressive lens implant inside your eye. There's some adjustment period. Your brain has to get used to them. And so just be aware of that if this is the path that you end up wanting to take. Now, not everyone is a candidate for these upgraded lens implants from a medical perspective. So you have macular degeneration, advanced diabetic retinopathy, advanced glaucoma, any number of certain eye diseases. You would not be a candidate for an EDOF or a multifocal lens because there is a risk of it, reducing contrast. And if you already have an eye disease where you're not seeing as well, then it's not ideal. And we would really recommend a monofocal lens in those cases. If you have had prior LASIK or PRK, one additional thing that you want to be aware of is that those surgeries do change the shape of your cornea. That's how they corrected your vision when you were younger. But as a result, they do make the calculations for the lens implant that goes into your eye during cataract surgery a little less precise. Great results are still possible. I have a lot of patients who have had LASIK or PRK before, and they do great with cataract surgery. But just be aware that you may not be totally glasses free after the cataract surgery, even if you were able to get out of glasses for your LASIK or PRK. On the day of surgery, you can expect to come up to the third floor of the Shiley Eye Institute. You don't have to go to the big hospital. You're in our same facility here. And you will get sedation from our anesthesia team. It is not general anesthesia typically, so not a breathing tube, anything like that, but it is sedation to help make you comfortable for the surgery. But because the sedation can make you drowsy, you're not allowed to drive the day of surgery, and you do want to make plans ahead of time to have a friend or family member with you or be able to give you a ride. Surgery itself does not take very long. Typically, we're looking at 15 minutes or less, but you do want to plan your day and be at Shiley for several hours, to get changed, get the dilating drops, have the surgery, recover afterward. You'll have a shield over the eye, but it won't be blocked off completely. It'll be a clear shield. And we usually do one eye at a time. So first eye, and then the other about 2 weeks later. We we recommend that you not do any heavy lifting, heavy exercise, or bending over for 1 week after each eye. The reason for that is that wound is the opening that we make into your eye to get the cataract out. It needs time to heal. And if you put too much pressure on it and you're exerting yourself too much, they can open up and then bacteria can come in the eye, and that can increase your risk of infection, which we really would not want. Again, to protect the eye, we'll have you do a shield when you're sleeping at night for the first week after each surgery. And then you'll be on 3 different eye drops, an antibiotic, and 2 different types of anti-inflammatory medications for 4 weeks after each eye. We give you really detailed checklists so that you can help keep track of those drops. Your vision might be blurry initially. In fact, for most patients, you're going to expect the vision to be quite blurry in the first few days after surgery, and then improves over time. And some people see an improvement over a couple of days. Some people see improvement over a couple of weeks. Everybody heals a little bit differently on a different time scale. So just be patient and realize that it is going to be blurry at the very initial outset. I will typically do a post-operative visit for you the day after surgery. Sometimes I do it the same day in special circumstances, like if we have a holiday the next day or the clinic is closed. We do additional post-operative visits based on clinical need, and at least one dilated exam at least a month after both eyes are done. If we're only doing one eye for this period of time and don't anticipate the other eye getting surgery until much further down the road, then we just do the dilated exam after one eye is done. But for a lot of patients who are having both eyes done around the same time, we'll do surgery on each eye, and then after both eyes are done, wait at least 1 month before we do the dilated eye exam. At that point, I'll be checking your eyes to make sure that you're healing up, that you don't have any residual inflammation, that the swelling has gone down, and then you can be measured for new glasses at that point, should you need them. So in today's visit, once you're dilated, I will be able to look at your cataracts, examine them under the microscope. I'll be doing a full analysis of all your measurements, your visual acuity, your any imaging or testing, your current prescription. And with all that together, I'll be able to tell you whether you're a candidate for cataract surgery at this time. We'll discuss the lens implant choices that apply to you that you would qualify for, and then any additional considerations, particularly if you have any other eye conditions that might affect the result of your surgery. This will help kind of define your expectations for what your visual potential will be after the cataract surgery. And of course, I'm available to answer any questions that you have. I am really excited to be working with you, whether or not you get cataract surgery. I've been doing cataract surgery for over a decade, and it is the best part of my job of being an ophthalmologist and being able to restore vision for my patients. And so I really look forward to working with you and guiding you through this process. Talk soon.